Good afternoon. Thank you for watching our live update for Tuesday, March 2nd. Today, I'll share a few brief updates about the situation here on campus, and then our Director of Construction, Tom Henning, has a few current project updates for you. Then Lynn McClintock will offer today's Pastoral Care segment. Let me start out with our COVID-19 update. I have to start out with some really good news, and that is that we currently have all of our employees that have tested positive over the past year now have either recovered or come back to work. And so that's really good news. At this point, we don't have any employees that are out positive. It's been a long time working towards a position where we have no active cases in our workforce, and that is really something to be celebrated. It's taken a long time. We do expect we'll continue to see some cases from time to time, but hopefully the worst of that for our workforce is behind us. So that's something to celebrate. As we've said last week, we have 4 independent living residents that continue to recover after testing positive a couple of weeks ago. One, thankfully, is asymptomatic and in quarantine in a tower apartment. One is being cared for in our COVID-19 positive unit here on campus. And unfortunately, 2 of our residents are being cared for at the hospital, and they remain pretty sick. So please keep them in your prayers, and we hope that we can get them back on campus here in the coming days and get them recovered and get to the place soon where we don't have any active cases on campus. Over the weekend, we continue to test our Parsons Health Center residents and staff, and so we continue, and now we've had no new cases at all in the Parsons Health Center for a few weeks. That's really good news. No new staff cases in the Parsons Health Center. So yesterday, we were able to resume our socially distanced communal dining for the residents in the Parsons Health Center. And what that means is they can come to the dining room. Everybody has their own table, but they can all be in the same room and dine together at different tables. They've been eating in their rooms or in the doorways of their rooms for what seems like a number of months. I don't know exactly how long it's been, but getting back to where people can come to the dining room and have that socially distanced meal is a big step. Starting on Monday, we'll introduce that same kind of communal dining in assisted living, and that's a big step in the right direction as well. These are just first steps, but they're big steps back towards restarting some things, and so we're really eager for that. Now for more on our next steps. In the coming weeks, Westminster Canterbury Richmond will restart some of our programs and services on campus, and we're going to start to re-engage with one another on campus as well. And that's a big step. We're eager to get there. With the guidance we've gotten from the Virginia Department of Health and our partners at CVS, we are planning on all of our restarting plans are based on the recommendation that we wait 2 weeks from when everyone got their second dose. So over the next week and a half, different team members from the different departments will be with us at our live updates to describe how that upcoming programming and services will start up. And then later this week, you'll receive everything in writing about our plans as well. This week and next, you'll get written details on what we're doing. Our goal is that some of the programming and in-person dining will begin on March 15th, Monday, March 15th. Then if things continue to go well, and we expect they will, we'll move on, open more programs, get to visitation, and that sort of thing. We hope you will join us in continuing what we've been doing here with moving forward with an abundance of caution, following all the recommendations and guidance that we've been getting from Virginia Department of Health and the Centers for Disease Control and CMS. We really do need to take it slow. We did hear today from the Virginia Department of Health epidemiologists that there is a good number of independent living facilities around Richmond that have active cases. And so we want to take it slow. We need everybody to get fully vaccinated. And by March 11th, everyone who got their shots last week at the vaccination clinics will be considered fully vaccinated. And that's really the beginning of when we can start reopening. So being fully vaccinated means that you've had 2 doses of the COVID-19 vaccine and that 2 weeks have passed since your last shot. It takes that full 2 weeks to build the full immunity that's provided by the second dose. At this time, vaccinated, all the recommendation we're getting and what you're hearing on the news as well is vaccinated persons, all of us, should continue to follow the current guidance and follow the principles we've been adhering to all along and that you hear us talking about frequently, right? Wear a mask whenever you're around anybody. Maintain your social distance of 6 feet. We will continue to screen everybody that comes onto campus, and we're going to continue to follow all the disinfection guidance that we've gotten from our partner agencies. And lastly, if you don't feel well, continue with that guidance of staying in your apartment, contact a clinic or contact your physician. It is still possible to contract COVID, and it is still possible to spread COVID. Hopefully you won't get sick, or if you do, it's going to be mild, but we want to make sure we get everybody who has any symptoms tested. We'll continue to test anybody who presents with symptoms. While we will have, starting on the 15th, we are going to have some in-person programs. Attendance limits at all of our group activities are going to be maintained, and it's really the social distance guidelines are what are going to dictate how many people we can have at different events. And we are going to continue to require masks for the foreseeable future. For our group activities, as they restart later here in March, signups are going to be required in many cases to help us with 2 things. 1, make sure we don't exceed our capacity limits, and 2, for contact tracing purposes. If we experience any new cases, we need to be able to notify everybody and do that contact tracing. These next steps that I'm talking about and you'll hear more about later this week and next will include restarting for programmings in the fitness area, in studio arts, recreational programming, cultural arts events with limited seating here in the Sarah Bell November Theater, pastoral care services and small groups, in-person dining and shopping opportunities in the marketplace and Galleria. For all of the things we're restarting, we are refining and modifying our processes and our guidelines with each of these as we go forward. So do expect there'll be a little bit of a change probably with every service that we're restarting. Our teams across the campus, our teams have been working hard to create ways to move forward as a group in vibrant, engaging living in this new world where we need to make sure we stay safe and do everything we can to protect this community from the ongoing threat of COVID. As circumstances change or, God forbid, we have more positive cases of COVID-19, our programming guidelines may have to change quickly like they have so many times before. We want to remain flexible. We're asking for you to remain flexible, and we need to ask for your patience and understanding as we proceed here. We need to move forward carefully. We don't want to find ourselves back where we have to put a whole bunch of people in quarantine. And so we're going to move slowly, but we are going to keep moving towards a better future here. Family visitation in all areas is going to continue to be suspended for now, except in those end-of-life and compassionate care situations, which we've been doing all along. We are monitoring our situation in terms of the current residents. We're working with VDH as it relates to the current residents who are positive, and we're seeking guidance from them on when and how we reopen visitation. As soon as the time's right, we are eager, as we know you are, to move forward with visitation. So that is part of the plan, and it is coming. We just got to get through this little period here between having active cases and getting everybody recovered before we can feel good about doing that. So it'll be after the 15th. I don't know exactly when yet. As of today, we haven't set that that date yet to resume visitation, but I do hope that by next week we can give you the dates of when that'll start. That's our hope right now. So we will be sharing the latest news and updates here at our live updates twice a week for the next few weeks at least. But in the coming weeks, please refer to TV 970 or 971, the Westminster Canterbury Tales, and Touchtown, the community apps, for the latest program offerings and changes, because there's going to be a lot of information coming out here in the next 2 weeks. If you need those details, go to the Touchtown app, or go to the Tales, or look for it on TV 970, 971, and we'll get. And then if you don't get the answer to your question, call Resident Services, and we'll get you the information as you need. So that's a lot of information. I appreciate your patience today and your participation in the live update. I'm done. That's it for me. Next up is Tom Henning. He's going to tell you about some of our current construction projects. And then Lynn will close us out. Have a good day. See you on Thursday.
Good afternoon, residents, and everyone that's listening to this cast. For the next few minutes, I want to update you on existing projects that are ongoing and some new projects that are going to be starting in the next few weeks. We're going to start with the tower lounges and hallways. The cabinet work will start on the floors 6 and 7 this week of the lounges, and finish work continues on floors 3 and 4 in the lounges, starting with the painting. The hallway painting is ongoing on the 6th floor. You'll notice they're doing some drywall finishes and trim patchwork right now, and then we'll have the 6th floor fully painted by the end of this week, and move on down to the 4th and 3rd floors to continue on with their finish and painting operations. The laundry rooms will be completed by April 1st, and those are underway on floors 2, 4, 6, and 8. And those right now are getting the tile work installed this week, and then we'll do all the plumbing and electrical final connections next week to get all that ready for the new washing machines and dryers that are going to be delivered in about 2 weeks. The tower grease trap project is coming up starting on March 15th. This work will be in the lower level mostly next to the Echo Shop, and we met with the resident representatives earlier today to review the scope of work in this space. We will also impact the lower level corridor outside the housekeeping and tie into the underground sewer line near the salon. We will work with resident services to ensure we can keep the salon operational during this project. This project will be coordinated with dining to ensure there is minimal impact. We're going to move over to Avalon now, and we're going to start the rooftop HVAC work has started this week. And a crane is going to be mobilized next Tuesday and Wednesday, March 9th and 10th. And the Avalon entrance will be closed next Tuesday, March 9th, and screening location will be temporarily moved to the Child Development Center entrance. On Wednesday, March 10th, the crane will be located near the CCL Port Cochere main entrance, and this location will be closed down for the day while the crane is in operation to work on getting the rooftop units to the roof in the Avalon, for the Avalon resident apartments. The Avalon 4th floor upgrades to the quiet room and theater room are underway. This project will be completed in April of this year. Avalon corridors will also have new carpet installed on all 3 floors, and that will happen after the HVAC replacement project is completed. We will have an update in April on the actual start date of this project. Apartment renovations, we have ongoing renovations in the tower and courtyard and planned renovations for the garden apartments. The noisy demolition work will only be during the hours of 9 to 12 and 2 to 4 every workday during the week. Noise should be minimal at other times, but please contact me if you have any issues outside of those time frames. For your safety, we have also started these project kickoff meetings with Zoom and Microsoft Teams video conferencing programs, and this will minimize the large group gatherings for the project tours and kickoff events. We have had great success, and we plan to continue doing this even after restrictions have relaxed. as we see that there's a lot more attendance, and they seem to go smoother with the video conferencing feature. That is your project update. Have a great week, and up next is Lynn McClintock.
Good afternoon. From Pastoral Care, I have 3 announcements. The first is that our March daily prayer booklet is now available. These booklets contain daily prayer for each day of the week and the Thursday worship bulletins. If you've not received a prayer booklet and would like one, please call Vanessa Perry at 1502, extension 1502, and David Curtis at extension 5179. Every month, I think that it's better than the last, and I feel that way again this month. The March prayer booklet is really great, so we hope that you are enjoying it, and if you'd like one, we'd love to get one to you. Our Thursday worship this week is 10:30 on TV 970. Reverend Bill Blake will be preaching, and Nancy Bain will be at the piano. So join us Thursday morning, 10:30 on TV 970 for worship. One thing to note is that this evening prayer will not be held on TV 970. Due to AV work in the Spiritual Center, we're not holding evening prayer this evening, but we'll be back tomorrow. We always thank Mary Chester Griffith and Miffy Hall for their faithful leadership in these beautiful prayer services Monday through Friday. So tune in tomorrow for evening prayer. We are getting close to the 1-year anniversary when COVID-19 came to town. It was at this time last year that Westminster Canterbury staff was working intensely on a plan to circle our wagons and find ways to keep you all and our employees safe. We were all increasingly concerned about our safety and the safety of our loved ones. Little did any of us know at this time last year what was in store for us. And those days seem like ages ago now. Here we are, a year later, and even at this point, we're not exactly sure how the road ahead will be in terms of group gatherings and meals and seeing families, but we know those days are just around the corner. So while we are definitely seeing some light at the end of the tunnel, we still don't know exactly how long that tunnel will be, but every day we are a day closer. So this is the time, this is sort of an in-between time where we are called to reflect upon how far we've gotten, to use those skills that we've learned as we go into this next phase. Skills and inner strengths like patience, perseverance, self-control, trust, faith, tolerance, management of fear and anger and anxiety. We are truly stronger people today than we were a year ago. One thing that I hope we can all hang on to is that while the path has been unknown for us, God has been present to help, to uplift, to uphold as we have traveled along. For as many times as I have had to answer a question with, I don't know, God has been upholding me with a wisdom and a presence far beyond my ability to understand. So despite all the upheaval that we have experienced this past year, God is still in control and will work good for us, and God will redeem this time. We're not the first people to wait upon God. If you read through Scripture, you will find people throughout the ages who have relied and trusted God to make the rough places smooth. Today I lift up a scripture from Isaiah chapter 40, verses 27 to 31. Why do you say, O Jacob, and why do you assert, O Israel, my way is hidden from the Lord, and my claim is ignored by my God? Do you not know? Have you not heard? The Lord is the everlasting God, the creator of the ends of the earth. He will not grow tired or weary. His understanding is beyond searching out. He gives power to the faint and increases the strength of the weak. Even youths grow tired and weary, and young men will stumble and fall. But those who wait upon the Lord will renew their strength. They will mount up with wings like eagles. They will run and not grow weary. They will walk and not faint. This is the word of the Lord. Thanks be to God. I'd like to share a poem with you written by Clarissa Pinkola Estes, and the poem is called Refuse to Fall Down. Refuse to fall down. If you cannot refuse to fall down, refuse to stay down. If you cannot refuse to stay down, lift your heart toward heaven and like a hungry beggar, ask that it be filled, and it will be filled. You may be pushed down, you may be kept from rising, but no one can keep you from lifting your heart toward heaven. Only you. It is in the middle of misery that so much becomes clear. The one who says nothing good came of this is not yet listening. Let us pray. Wash me from all that I think I am, my struggles, my stands, my cherished opinions, my soaring dreams, and deadening fears. Leave me only your purity and your peace. Wipe away the masks of judgment I have placed on your children. Show me the faces made in your likeness, that I may see my own as well. Brush aside all shrines to the future, all altars to the past. Give me your golden present, a home in you, unmovable and eternal. Still all the voices within me. Fill me with your hush of your peace. Now you are my thoughts, my purpose, and my way. All I need and all I am is you. This prayer was written by Hugh Prather. We are glad that you joined us today, and we invite you to join us on Thursday at 3 p.m. Go in love.